Hello coders, this is your Vidyavrat. Let us get into coding endoscopies today. For coding any procedure using CPT, understanding terminology is very critical. So what is an endoscopy? Endoscopy means viewing or visualizing inside. If we break the term endoscopy, endo means inside and scopy means visualizing or viewing. Endoscopies are performed using rigid, which are stick-like, or a flexible tube that are attached with a camera and light, which would allow the physicians to view inside of the body. There are various types of endoscopies depending upon where it is inserted from and which part or parts are being visualized. For an example, if the endoscope is inserted through mouth or nose and visualized esophagus is what is called as esophagoscopy. There are three different types of esophagoscopies. If the rigid endoscope is inserted through mouth to visualize esophagus is what is called as transoral rigid esophagoscopy. Transoral means through mouth. And this is what is the range of codes available for this type of esophagoscopy. If the flexible endoscope is inserted through mouth to visualize esophagus is what is called as transoral flexible esophagoscopy. If the flexible endoscope is used, which is inserted through nose, transnasal, to visualize esophagus is what is called as transnasal flexible esophagoscopy. If the endoscope is not stopped at esophagus, if it is passed further down into stomach, visualizing stomach, and also first portion of duodenum, it would be called as esophagogastroduodenoscopy or otherwise EGD. If it is not stopped even at first portion of duodenum, if complete duodenum is visualized and passing further, visualizing jejunum, it will be called as small intestinal endoscopy or enteroscopy. Entero means small intestine. There are two types of enteroscopies. One is without visualizing ileum, only up to jejunum is what is one type, and another is visualizing even ileum. There are other endoscopies related to digestive system apart from what we have discussed. If the endoscope is inserted through anus, visualizing anus and up to the lower portion of the rectum is what is coded as anoscopy. If it is passed further, visualizing entire rectum and first portion of the sigmoid colon is what is coded as proctosigmoidoscopy. If it is passed further, visualizing entire sigmoid colon and even descending colon is coded as sigmoidoscopy. Once the endoscope takes the turn into transverse colon, it would be coded as colonoscopy. Visualizing entire colon up to cecum is what is colonoscopy. Each type of endoscopy has its range of codes. Similar to endoscopies of digestive system, there are various endoscopies related to various systems. Nasal endoscopy is also called sinus endoscopy as physician can access sinuses using nasal endoscopy. Frontal, maxillary, ethmoid, and sphenoid sinuses can be explored using nasal or sinus endoscopy. Then laryngoscopy is what is visualizing larynx including voice box. There are three types of laryngoscopies: indirect, direct, and flexible. Then bronchoscopy and then thoracoscopy. Thoracoscopy is also known as VATS, video assisted thoracic surgery. These are what are the endoscopies related to respiratory system. Cystourethropy and cystourethropy with ureteroscopy and or pyloscopy are the endoscopies related to urinary system. Arthroscopies are the endoscopies related to musculoskeletal system. Colposcopies and hysteroscopies are related to female reproductive system. These are the various kinds of endoscopies that we come across. Now let us move on to understand what is the use of an endoscope. There are two important uses of any endoscopy. One is diagnostic and another is surgical. Diagnostic endoscopy helps in examining and identifying the problems, helps in making the diagnosis. And surgical means it helps in performing minimally invasive surgical procedures such as biopsies, removal of tumors, removal of polyps, removal of foreign bodies. All these can be performed using an endoscope. Coming into coding, for each kind of endoscopy codes, first code will be usually diagnostic, followed by all surgical codes. If we take sigmoidoscopy as an example, as you can see here, it is starting with diagnostic, followed by all surgical codes with biopsy, with removal of foreign body, with removal of tumors, polyps, or other lesions. Similarly, if we take another example of bronchoscopy, again, it is starting with diagnostic, followed by all surgical codes. Now that we know the terminology and how the codes are structured around the endoscopies, let's get into coding endoscopies. For coding endoscopies correctly, we must follow the guidelines. First and foremost guideline is diagnostic endoscopy is included within surgical endoscopy when performed in conjunction and is not reported separately. What do we mean by this is when both diagnostic endoscopy and surgical are performed in the same endoscopic session, we must code only surgical endoscopy. Diagnostic endoscopy is not reported separately. Let's take an example and understand the guideline. A patient presents today with the chief complaints of abdominal pain, nausea, and hematochezia. The physician planned for a diagnostic colonoscopy for diagnosing the disease condition. During colonoscopy, the physician found colon polyps in the transverse colon, which were removed using hot biopsy forceps. Here in this question, physician started the endoscopy as an diagnostic. However, he has performed surgical procedure which is removing the colon polyps using hot biopsy forceps. So as per the guideline, we should code only the surgical colonoscopy. Let us take the options and see. The first code in the option A is 45378. 45378 says colonoscopy diagnostic. As per the guideline, there will not be diagnostic code because the surgical procedure is done. So option A is incorrect. If we take option B, again, it's just diagnostic code. So option B is also incorrect. If we take C, 45384 is colonoscopy with removal of polyps using hot biopsy forceps. Yes, this is what is the answer. If we take option D is also incorrect, is just because as you see the code 45385, it says colonoscopy, removal of polyps, but the technique is snare technique. Here the physician has used hot biopsy forceps. So option D is incorrect. Moving on to next guideline, endoscopies should be coded based on how far the scope is passed and not on the basis of where a procedure is performed. To understand this guideline, let's take an example. A 56-year-old patient presents today with severe dysphagia, nausea, and vomiting. The physician planned for a diagnostic EGD. During endoscopy, the physician found esophageal polyps, which were removed by snare technique. The endoscope was then advanced to stomach and proximal duodenum, which were normal. In this question, the surgical procedure is only performed in esophagus. However, the endoscope was passed up to proximal duodenum, which is first portion of the duodenum. So as per the guideline, we should go with how far endoscope passes is what is it is coded as. So here it would be coded as esophagogastroduodenoscopy. Coming to the options, if we take option A 43200, it says esophagoscopy. So definitely it's not esophagoscopy, it is esophagogastroduodenoscopy. So option A is incorrect. Option B again 43217 is esophagoscopy code. So even B is incorrect. As we move on to C, 43235 is esophagogastroduodenoscopy. However, this code is a diagnostic code. When a surgical procedure is performed, we are not coding diagnostic separately. So even option C is incorrect. Moving on to option D, 43251. 43251 says esophagogastroduodenoscopy, removal of polyps, and snare technique. Yes, this is the correct answer. Moving on to the next guideline, multiple codes may be necessary to cover one endoscopic session. What do you mean by this is, within one endoscopic session, physicians may perform multiple surgical procedures and multiple codes may be required to report, is what is this guideline. Let us take an example and understand it further. A patient was presented with chief complaints of abdominal pain and rectal bleeding. The physician scheduled the patient to have lower GI endoscopy. During the procedure, the endoscope was passed without difficulty from anus to cecum. There was a 3 mm polyp in the sigmoid colon and a small tumor in the transverse colon. The polyp was removed with snare technique and tumor was biopsied. There was a bleeding ulcer within the descending colon as well, and the bleeding was controlled using electrocautery. If we carefully look into the question, the endoscope was passed from anus to cecum. As per previous guideline, any endoscope is reported on the basis of how far it passes, not on the basis of where the procedure or procedures are performed. So definitely this endoscope is colonoscopy. And what are the procedures that are performed? One is removal of polyp using snare technique, and the tumor was biopsied, and also bleeding was controlled. All these procedures were performed in a single endoscopic session. First is colonoscopy and 3 procedures are performed. If we take option A here, 45385, 45385 says colonoscopy flexible with removal of tumor polyps by snare technique. Option A is not reporting other procedures here. So option A is incorrect. If we move on to option B, 45385 is definitely a colonoscopy and removal of polyp by snare technique. And 45380 is what is a biopsy code. And 45382 is a control of bleeding. All 3 surgical procedures are being reported in option B, and this is the right answer. Option C and option D are incorrect as these codes are related to sigmoidoscopy. There are 2 more points that needs to be remembered while coding endoscopies. First one is, if a biopsy is performed of a lesion or a tumor and the same lesion is excised later during the same endoscopic session, only excision must be coded and biopsy should not be reported separately. This is what is the first point. Second point is, if bleeding occurs because of an endoscopic procedure, controlling the bleeding is not reported separately. This is the another point. These are all we should keep in mind while coding endoscopies. If you really like the video, please subscribe, like and share. Thank you.